Welcome. Hopefully, Dr. Lyle, you can hear me. How are you doing today?
Good. How are you, Chris? Soon to
Doing
get
well.
to you, Chris.
Yeah, no, yeah, and I'll speak about that as we go. Stephen, do you want me to just kind of carry on with what I planned, or
Yes. So,
great?
sorry. So today we're going to talk about pre and post usage of KAATSU, specifically the KAATSU cycle, where we're going pressure on. We're pressurizing the bands for 30 seconds and then releasing them for 5 seconds. If you have the C4, C3 model or any earlier models, and if you have the KAATSU B2 model or B1, you can actually customize that and you can pressurize for between 20 to 60 seconds and then depressurize or release air from the bands between 5 and 20 seconds. So B2 has a few other additional nuances that experienced people can use, or you can ask various questions. So yeah, that'll be the theme of this. The reason why Dr. Nalli is here is he works obviously on anything below the ankle. And Dr. Nalli has done a lot of work and rehabilitation of himself. He's used it as an athlete, as a swimmer, and he's using it for longevity himself. So he has various different perspectives. Dr. Nalli, you were doing surgery at least once a week, correct? Throughout your career.
Right. Right.
Yeah, yeah. And then Chris has actually worked with a number of Olympic and professional athletes and celebrities in all forms for performance, meaning gaining muscle or getting more fit for movies, to professional athletes who wanted to get returned back on the field of play as soon as possible. That includes people who've had Tommy John surgery, various knee injuries, all kinds of joint injuries, and then he, of course, always um, works with everybody on the longevity and performance side. So, yeah, go ahead, Chris. I just wanted to lay the groundwork for today's show.
Yeah, no problem, and thank you again. So I think one thing that I'd like to share, and we can talk a little bit about what I'm doing in my studies, and then certainly Dr. Lyle would love to hear your comments on what I share, and also your sort of your journey and some of the things that you would think also as somebody much more qualified than I am to speak about medicine or anything where we um, go inside of the body. I know what's happening inside, but certainly I'm not licensed to do that. But I think what's really interesting in my story, and Stephen, I've shared this before, and we've shared it on other webinars, but I think it will be appropriate to what we're doing today is I've been doing KAATSU now for over a decade, and my first experience with KAATSU was when I was a varsity swim coach at Harvard University. I had lived in Europe for 15 years. I had a background in exercise science, but in movement science. So I attended the University of Lausanne in Switzerland for my master's degree in movement science. So I was always fascinated about how we move and tools and other modalities that can help us move better. So while I was at Harvard, I met Stephen and started on my journey with KAATSU. But just several months into it, and Stephen remembers this, it's a story we tell that's become a bit of a legend, but a true one at that is while I was just turning 40. So, Steve, it's actually been almost 14 years ago. I decided to do one of these obstacle courses here in the Northeast. I live in Boston. They're called Tough Mudders. They're also known as Spartan races, and they're basically endurance events that go anywhere from 5, 6 miles to 12 miles. And I say it's sort of how we deal with our middle age crisis, Dr. Lyle. So I had been 10 miles in and I slipped on one of the last obstacles and I landed on my ribs. And the only bone I had ever broken in my entire life was two ribs. So when I fell, I sort of thought, ooh, I think I broke a rib. But I carried on and toughed it out. No pun intended. It was a tough mutter. And the next day, so that was on a Saturday. On the next day, which was Sunday, I told my wife I needed to go to the ER. So I took myself to the ER and they did an x-ray, and lo and behold, I had broken two ribs. On that following Monday, and again, this will be appropriate to our story today. I had a session with one of my KAATSU senseis, who is a colleague of Steven's, Mr. Shimizu, who is a gentleman out of Japan who learned directly from the inventor of KAATSU and what we call as the origins of BFR, blood flow restriction. So Dr. Yoshiaki Sato. So Mr. Shimizu was in living in Boston for several months teaching me, and I said I couldn't go because I was in so much pain, and he said, no, you must come. So I went and he talked to me about the KAATSU cycle. And so I took his advice, and not to dwell too long on the story, but I did KAATSU, Stephen, you remember, every day, twice a day, 3 times a day, and only in the cycle mode. So pressure on, pressure off, increasing pressure. But I did it on my legs in the morning. I did it on my arms in the afternoon. And then I would either, depending on my mood, I would do a third session before sleep. Um, and as the week went by, my discomfort and pain, it reduced significantly. And I thought, must just be a placebo. So I took the X-ray that I got at the ER, and 8 days later, I tricked. I'll be honest. I tricked the trainers in the training room at Harvard University. Won't get anyone in trouble with that. To do another X-ray. So 8 days, and Dr. Lyle, I think you remember seeing these X-rays. We had 2 different X-rays side by side, 8 days, and the doctor said, "Well, you must have broken your rib, but several months ago." So for me, that was sort of the light bulb went off, and I realized that in 8 days I had an exponential amount of healing on ribs. So that's when I also said, well, the KAATSU bands are on my arms or on my legs. How are my ribs being helped? And that's when I started to understand the systemic effects. And now, fast forward a decade later, I'm studying KAATSU as part of my PhD in exercise science. And really are what we're actually studying. And just to take a small side step is that with exercise and KAATSU cycle, for people who've had a serious cardiac episode, from aortic valve replacement to other different cardiac episodes, adding the KAATSU cycle to regular exercise compared to just exercise compared to nothing is exponentially more beneficial for a lot of different biomarkers, and even just anecdotal how they felt. On a scale of 1 to 10, we use that as a sort of a modified Borg scale on just how they're feeling. And those who are using KAATSU cycle with exercise significantly showed quicker, better, and more positive improvement. So, Stephen, I don't know if that's a good start for us to talk about how, this was I guess a post, not an operation, but a post accident, and where we're using the KAATSU cycle really helped. What we know, Dr. Lyle, is that with KAATSU and the increases in a lot of different fertilizer, as I call it, for our body, we're really helping the vascular system, right? So whether we're talking about somebody with even a scar, as simple as scar, we've seen the changes and the evolution of a major scar to simple paper cuts, where things from ceramide to different molecules are really helping the healing process by using the KAATSU cycle. I don't know if Stephen or Lyle have a comment on that.
Well, as a podiatrist, I know I'd only do surgery from the ankle on down or treat leg ulcers on down. And by the way, Chris, you talk about motion. Our doctorate degree is biomechanics. So if this is the foot, I always show the foot. It rotates in the transverse plane, sagittal plane, and the frontal plane. So whenever you're dealing with the foot, you're dealing basically with origami. That's how I look at it. And so let alone if you're going to do a surgical correction, you have to know all 3 planes. But with all that aside, over the course of many decades, I found out that the healing process, no matter how great a surgeon was, if you didn't take care of the swelling, that impeded healing. And I go back to some basic stuff, elevation, I can get into that later. But if I really control the elevation, not only do the pain subside, and a lot of my patients, after putting typical reconstructive surgery, I'd use 2 plates, 8 screws, 9 screws, typically in about a 2.5-hour surgery. Most of my patients use 5 pills or less of pain pills. I made them take an anti-inflammatory because I didn't quite trust them. But going back to your rib issue, that rib that's nowhere to go, the bone is surrounded by what I call a saran wrap. There's fancy name, periosteum, blah, 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 all those fancy names for it. But if you look at it simply, imagine you have something broken, it's trying to swell, it's surrounded with plastic, it can't go anywhere. That causes a pain. And I think with KAATSU, I was finding out indirectly, clinic issues, that by increasing the blood flow, you also improve the removal of edema. And I think Steve and I had a talk about that later too, about injuries and ice versus KAATSU. That's all I want to add to that.
Stephen, you're muted. We'll have Stephen unmute.
I'm sorry, I'm going to share my screen here.
Sure.
Oops, first. And we have something here called IPC, ischemic preconditioning. It's a process that probably Dr. Lyle has conducted, and what they do is they use occlusion cuffs or tourniquets, and they actually increase the pressure to 200 mmHg for 5 minutes, and then release the band for 10 minutes. So 5 minutes on, 5 minutes off. This is done with surgery. And what we did is we looked at how does this kind of process that's used in the medical community compare to the KAATSU cycle. And we did a variety of things. We can go in more detail on this, but what we found was, as Dr. Lyle stated, is when we allow the perfusion of blood in the very, very small capillaries, this actually aids the ability for the surgeon to do what he or she needs to do. In fact, I'm actually on a boat right now with an orthopedic surgeon who does precisely that at the National Rehabilitation Hospital in Mexico City. And what she does is, whether it's a lower body or upper body surgery that she does, she uses a KAATSU cycle, and very similar to other surgeons doing this ischemic preconditioning. She pressure on, pressure off, pressure on, pressure off, as we all know with KAATSU. And then what it does is it engorges the limb in blood. It actually allows that tissue to be more pliable, more soft. This is what the Japanese learned back 35 years ago. And then it's easier to get, not only open the body, open the skin, but also do what you need to do, which Lyle's does thousands or tens of thousands of times. And then once you close up the wound, put the sutures on, they continue to do this pressure on, pressure off. Why? Because they want those hormones to actually start allowing the incision, both inside and the skin level, to actually start creating a matrix to heal. And I know, Lyle, I'm not, Dr. Nalli, I'm not using the proper medical terms, but if you could expand on that, that would be helpful.
A lot of times the typical medical terms, people get confused. So I found that going back to basic terms, make it as simple as possible. People understood, I got better compliance. But I think what KAATSU does is takes what we naturally have, and I think someone said put on steroids. It steps up the process so it happens at a quicker ratio, quicker time. Steve, long ago when we first started, that one Olympic skier who shattered his shoulder, I saw the MRI. It was in bits and pieces. And was it 29 days? He was good enough to compete in the Olympics. And basically, before KAATSU, his options were nothing. He had to have major surgery, or the bone was going to heal very disproportionate. And that's where I think a lot of people ask, why does it work? This is where we need the research. Research has been done, but unfortunately, when I was more active in it, a lot of studies were small population. And then, of course, we come to America, and I came across a lot of closed doors or people who didn't want to go further with KAATSU. Even though I have anecdotal proof, it's hard to go forward with this. But I'm getting off topic here. I'm sorry. Just a simple cycle. It makes sense, sort of, but as soon as I understand it, I don't know why it works. And that's we can go round and round, and we have to decipher between the two. Just get people to try it and use it. It's non-invasive. It's not electrical.
Maybe the best thing here is to, there was one individual who raised their hand. Kim, you raise your hand, and then other people can actually add questions in the chat, which you find below, and we could just answer questions. That will actually help direct the conversation. So, Kim, if you wanted to ask your question, you have the floor now. Hello, Kim.
Hello, thank you so much. First of all, great information. I'm really excited to hear about the success and the progress you've made with particularly fractures. You know, with your story, Chris, that was incredible. And then also, Dr. Wood, you were sharing with us as well about the healing and it's beyond anything that most doctors can understand. So I've come across this personally myself just recently, an accident and multiple fractures, and oh no, this is, you just have to wait. You can't do anything more. This is it. So that was really where. So you really touched on it. It's almost like through osmosis, you kind of read my mind and where I was going. So that's really the question: is that, you know, how this seems to expedite the healing. Particularly in fractures, well, most I can see many issues, but I was kind of focused on the fractures just because of recent accident.
Best when they can't do anything. It sounds like multiple fractures. Where do you go? Last year, my wife and I were in Europe, and she did a rotational fracture where she turned suddenly, and I thought she sprained her ankle. It turns out she fractured her ankle. But we did KAATSU legs on her right away from the get-go, elevate and ice and KAATSU. And within a week, she was doing pretty well. And at 3 weeks, we were walking around, slight limp. When we came home 8 weeks later, we took an x-ray, and she had a spiral fracture complete from one end to the other, turned all the way around the ankle, but non-displaced. And for her to walk on that, there was a period of, like I said, about 8 days where she dramatically felt better, and not just our typical taking care of the swelling, which I was on top of her, elevation and ice, but I'm dollars to donuts. The KAATSU is what stepped up that process of healing, made her symptoms much more bearable.
So when we recommend KAATSU for rehabilitation, whether it's a laceration, a muscle rupture, muscle tear, a bone break, or a connective tissue rupture, we fundamentally explain that the pressure needed to heal skin versus the pressure needed to heal muscle, bone, or connective tissue is slightly different. Because the skin and the muscle is very capillary rich, and the bone is less capillary rich, and the connective tissue is capillary poor, we actually advocate using more pressure when you are dealing with a connective tissue or bone break versus a laceration or muscle tear or strain. So in other words, we always want people to start with a low pressure. But as long as you have good capillary refill, meaning fast capillary refill, then you can progress to medium and high, and then in some cases, in many cases, actually progress to a customized level, which is even higher than high. So you have low, medium, high, and then custom, which can be quite high, actually, the maximum of 400. In addition to the amount of pressure that you're doing, we also recommend when you have the bone or the connective tissue injuries that you put the band on, tighten it up as you normally do, one finger tightness, what we always teach. Do 2 KAATSU cycles, at least 2 KAATSU cycles. You could just be sitting as I am now. And then take the band and retighten it. And you'll be quite surprised after you've done KAATSU cycles, 1 or 2, you can actually tighten the band without any additional, without any discomfort or pain. What happens is as that vascular tissue becomes more elastic, the ability to tighten the band even more, which is very important for a bone or a connective tissue injury. So not only are you increasing the pressure of inside the band, that pneumatic air bladder, but also increasing the manual tightness and increasing the time under tension. So instead of 3 KAATSU cycles, do 6 KAATSU cycles, or instead of 1 KAATSU progressive cycle, do 3 progressive cycles. And that actually means that we also advocate doing it more than once a day. Twice a day, we have people who need to rehabilitate faster. Perhaps they are going on a business trip. Perhaps they're going to a major competition. Perhaps in one case, he was a stand-up comedian and he couldn't stand up. And he says, I have a gig and I need to stand up. So in these cases, we advocate doing it 2 or 3 times a day. Separate, distinct sessions within a 24-hour period, but definitely 3 separate ones. So you can actually work with the band to manually tighter. Remember, always checking your capillary refill. So the blood comes back very, very quickly. 2, you can put the pressure higher, so low to medium to high to customize. And you can increase the time under tension, meaning the number of KAATSU cycle sets or the number of KAATSU progressive cycle sets that you do. So those are the practical ways that you can do this. Now, on a molecular level, we are working with several doctors now, and they are formulating the vernacular in order to express this so everybody can stand easily. And we're currently working on that. And hopefully within 2 weeks, we'll have that vernacular down. And so, Kim, if you had any questions, remember to, or if you can, email us at info@kaatsu.com, and then we will send you out that vernacular that will explain the mechanism of what is happening on the cellular level in order to enhance healing.
Fabulous. Thank you so much, Steve.
Okay. And Mona raised her hand. Go ahead. You have the floor, Mona. Hello.
Can you hear me okay?
I'm having a little bit of problem, but Dr. Nalli and Chris, can you hear her?
No, she's breaking up. Does she have it on speakerphone? Maybe that's the problem.
Can you hear me okay now?
Yes.
Yes, that's
Okay.
good. Yes.
Turn your headset off. So a couple different. One is a comment. I'm using it for myself first in terms of the KAATSU. And I actually did a DEX scan before and a DEX scan after. And I did 6 weeks of no real exercise, just using the KAATSU. And I had an increase of 2.5 pounds of muscle. Just with my regular diet and just using the KAATSU instead of my normal weightlifting that I do. I weightlift 3 days a week. My question relates to using it with an older person. I have a mother who's 82 years old, and I've started her using the KAATSU, but it's difficult to get the band, especially up on the legs, all the way up to the groin area. So is it all right that it's lower down, or does it matter? when I looked at your found your thing about the 103-year-old lady who used KAATSU and the little video of her. Those bands were not really up at the groin area. They were more like middle of the leg.
Yeah. Sometimes, so in the the centenarian who did it, she actually wears diapers, and so when we put it on, we couldn't actually get it up past her diapers. So yes, in some cases, and sometimes it's people in wheelchairs, sometimes it's people who are disabled, sometimes it's people who are overweight or have some kind of issue. That includes continuous glucose monitors or other things. So you can actually so what you do is you put it up as high as you can. But if it's closer to the knee, then simply put it on, if you can, the other limb as high as you can. If both legs you cannot reach much higher than the limb, the knee, then actually use it on your uh, arms only. And hopefully you can have it high up on the arm with her.
Okay. Yeah, she finds putting it on the arms more painful than putting it on the legs. I'm not sure. When I was first using it, I had to do like a 5-finger tightness. It was really loose. And then over time, as she's gotten used to it, I've been able to do a little bit tighter. The arms are the same kind of thing. It's, I mean, I do always test the reactive, make sure that we're getting the right refill time back. But it's interesting. I mean, as the more she's using it, the more comfortable she gets with it.
Yeah. When you put it on her arms and it was painful, was it on bare skin or on a t-shirt?
No, it was on clothing.
Okay. So when we have these kind of usually they're older individuals, but sometimes they're as young as teenagers. They don't like the feeling. We actually have them use a sweater, a down jacket or something, and place the bands over it. It acts as a cushion, and so sometimes that helps with the tightness. However, remember the 1-finger tightness is only a guideline. As long as you can see the pinking up or the rosiness color of the skin, then you are achieving the KAATSU effect that you want.
Okay.
The approach I've used as well, a good friend of ours, his mother's 94. She was introduced KAATSU about 3 years ago. She used it 3 times a week. And she started off on her arm just barely enough to hold on. If any loose would fall off, and that was the starting point. And now she's a regular user and looks forward to it. But she does arms only. Too much of a hassle to get the legs. And she's doing very well with it, if that helps.
Yeah, I think Mom's getting less. She suffers from arthritis, and I think her arthritic pain is less as you're using this device. So I find that helpful. And then you guys were trying to figure out what process this is allowing for the healing. I think Dr. Sadhu had a video where he talked about nitric oxide and that it's generating nitric oxide, which then causes a whole cascade effect within the body. I think that's what it is.
Yeah, yes, that is true. What we're working on now is actually what are the catalysts for the nitric oxide and vascular endothelial cells to actually be produced in the first place. So we're diving a little bit deeper than just simply saying that the nitric oxide production is enhanced. We've known that for 20 years, but we want to understand more of the cellular mechanism of what is happening.
Do you know if it's generating autophagy in any phase?
Sorry, Chris,
Well,
could you
once
answer?
again,
I'm not.
Do you know if this is generating any type of autophagy or autophagy?
I must have a problem hearing. I didn't quite understand the two phrases you're using, or else I'm not familiar with it.
Yes, the answer would be yes to that. I'm gonna over here.
Yeah, Mona, if I could jump in, the answer would be yes. And um, just to also support with your, I believe you said it was your mother. So my mother is 80 and my father is 83. Again, very anecdotal. They both are KAATSU users. It took me a long time to convince my father, but after he had a very good feeling after, it was all he needed to, and they only use KAATSU Cycle. My mother actually walks on a treadmill, but she uses the KAATSU bands on her arms in the cycle mode because she also she was a little bit in her late 70s, a little bit overweight. So to use the bands and walk just created a little bit of discomfort, not from the KAATSU, but just from the actual ergonomics of it. And so we started doing it on her arms. Steven's parents also are in their upper 80s, Steven, right? And so lots of great, again, anecdotal, but when we pile on all these anecdotal stories and see the safety and the smile that they have after, so that would be my answer, Mona.
Thank you so much.
There was a question from Nick. I'm going to jump in here with. He had a laminectomy on the L2, L3 30 days ago, and what would be recommended? He has the current B2 arms and legs. Same thing again. Confirm with your doctor, but also we recommend twice a day. Always while you're seated or relaxing or lying down. Always start on the arms. Always start with low pressure. Always and only do the KAATSU cycle. And pinker than your capillary refill time is quick, like that, then you're fine. I would do up to 6 sets on your arms and up to 6 sets on your legs in your morning session, and then also in the evening section. Over time, if you would like to increase that pressure to a medium, the high, or the customized, then I would do that. You can do that also, but only while you're sitting down or lying down and in a relaxed position. I would wait. It's still only 30 days, so I would wait until you're doing physical therapy with the KAATSU. You're fine doing your own physical therapy and then separately using the KAATSU in the KAATSU cycle mode. Okay, we have I think a few other people raise their hands. Is that true? Sammy?
Yes, sir. Yes, sir. Thank you. I am 3 weeks out post-op of severe rotator cuff tear. If this does not take, then I have to have a replacement done. So I'm doing everything from peptides, KAATSU. I've been running it one cycle on the low, 1 cycle medium, 4 cycles on the high. On the arms, I have not done both arms and legs, but any protocol suggested would be very well appreciated.
Okay. So what you want to do is you want to build up as much lactate as possible in order to have as many healing hormones flow through your body. But because of where your injury is, I would do very, very slow hand clenches or take a towel and wring it. So you're really building up some lactate in your forearms, do slow and then fast, slow towel, what do you call it, twists, and then fast. And that will build up a lot of lactate that will lead to a variety of other a cascade of proteins and molecules. In addition, I would also strongly recommend that you go for a walk or you do leg exercises also. So you want to do both your upper body and your lower body, because you want this to take and not have to face surgery.
Thank you.
We have we have a few questions coming in. The question is, I'll read it out loud. I had surgery for a meniscus tear on my knee on May 19th. I still have pain after 14 weeks. I had a Dr. Lyle, I don't know what this is. Hemophis injection to lubricate the joint. Will KAATSU help or interfere with the healing? I want to get back to playing pickleball regularly, and this is getting tiresome. I assume that tiresomeness is the 14-week recovery period.
Well, I always approach KAATSU, Steve, with this is ancillary health. My patients who did KAATSU after foot surgery or ankle surgery on their arms or their upper leg, it wasn't anything connection with the local surgery in the ankle or foot. But I just found doing the basic protocols like you just discussed, the cycles, it's amazing. It takes patience because it's so simple and you can't believe it's working. Just cycle your tolerance to higher pressures or tightening the belt like you showed. That alone, if you track it, I've found great success for reducing symptoms or pain. If you're still having symptoms or pain, chances are there's something amiss with the surgery at the surgical location. You may have to check with your specialist to see what's going on there. But again, I use KAATSU because it affects the whole body, not just where you had surgery. And because your body sort of needs more repair process at the surgical site, the KAATSU tends to cause its favorable effects to focus on that area. That's why I look at KAATSU for post-op.
Thank you. There's another question. I'll read it. Sometimes I use the armbands, and after a while, my hands start to go numb. I take it that it's a sign to stop the program. Usually this happens on the highest arm setting and occasionally in the middle setting. This doesn't happen in the low setting. Precisely. This is actually a very common mistake with KAATSU. People assume that higher is better. They assume that more pressure somehow leads to better results, and that is not the case. The best pressure with KAATSU is one that does not cause any pain, does not cause any numbness, and does not cause any clamminess in the palms. These are all signals that your body gives that you've gone too far, you've gone too much, you've gone too high. So what you want to do is you want to make sure that your hands are pink and rosy, or your tops of your feet are pink and rosy. It doesn't mean to be a dark red, a maroon, a purplish color. It just means this nice, solid kind of pink and rosiness feeling. To do that, you always start in low. And if you want to go to medium, if you want to go to high, that's okay, as long as you avoid that discomfort, the clamminess, the numbness, the tingling, etc. Those are all signals that you've gone too high. Just because you're on low does not mean you're getting a lesser effect. So, and many people assume that. They assume more pain, more gain. And with KAATSU, that is not the case. This is a means to help increase elasticity of your vascular tissue, which is the catalyst for a bunch of hormones to be flowing through your body. that is precisely what we do. So everybody is different. You can improve over time, or you could stay at low for the rest of your life. Everybody's slightly different. Maybe what you can do, if you do really want to go higher on the arms, start doing legs more. It's a lot easier for most people to increase their leg pressure than their hand pressure.
Steve, that brings me a good question. With my trainer, he was mentioning the other day that he always wanted to do upper body, and he found out that if he doesn't do his legs, he's not balanced. And I'm wondering out loud here, if we're only doing the arm bands, ignoring the legs, perhaps that's part of that same methodology. We should be doing, if you do more arms, you should be doing some legs as well, so to get a balance of both, or am I just off on that?
Well, imagine if someone only does, if they're into weight training, and you've probably seen this at the gym a lot of times, you quite often have men with huge biceps and a gut and skinny legs. Maybe that's what they're after. But if you do want a more balanced aesthetic, if you do want a more a body built for a long, healthy life, then you are working on the upper body, the core, and the lower body all the time. And therefore, we always recommend do arms and legs. You don't have to do arms and legs at the same time, but you could do, let's say, in my case, I do arms when I'm in the office, sitting down at a desk, because I can do it on my arms very easily. But in the afternoon, when I go for a walk or walk my dog, I'm doing the KAATSU on my legs. I match the convenience of doing KAATSU with what I do on my arms or legs. But it's very, very important to do arms, legs, and the core. And why is the core important? Is because that helps you with balance. It helps you with strength. If you could have huge biceps and I don't know, strong hamstrings, but if your core trunk muscles, your lower back and your abdominal are not equally strong, then you're imbalanced. And Dr. Nell, you know, as an athlete, you want to be balanced, you want to be streamlined. All these things are very helpful. So working on all four limbs and your core are key, absolutely key.
So Steve, let me follow that train of thought just a little bit further here before we go on to the next person. You do your arms, do your legs, and your core. So should you be doing, like you showed before, like a stand up on one leg as well, or try to do a plank, these type of things? So when you're doing the arms, you're just sitting doing desk work. You do your legs, you're out for a walk. When you do your core, should you give some ideas what things are constituted core, and should you have a KAATSU belt on as well, arms or legs?
Yes, core, we recommend, it's not necessary, but we recommend KAATSU on the legs when you're working on your core. That includes in a plank position, that includes balancing on one foot, that includes your regular sit-ups or on the legs, and elevate your legs. All this is best to do with the core, with bands on the legs for your core.
Yeah, beautiful. I'm going to see what's going into that.
Steve and Lyle, we've had Jessica who's had her hand up for quite a while.
Hello?
Hello?
Hello? Hi. Oh, thanks. This is so good that you guys are doing this webinar because I had a few questions. I'm new to the KAATSU. I just bought it because my friend said you should get this because she sees that I'm not exercising. I'm a farmer and my upper body is a little sore from farming. You know how you have redundant movements? And I get migraines sometimes. So I was reading through your material, something about it balances the hormones too, or something like that, or hormonal. So I really wanted to get started, but I think only one of my bands inflate. So I'm working on that with customer service, but I asked if I could
still use it with only one side because I was worried that if I don't have both working, for the arms. And I got a response from Raphael, said yes. So my next question, so great, because I'm gonna, while I wait for the whatever you guys are doing, I'm gonna try and use one at a time. But how do you recommend I do that? Because I did all the videos from your 101 course, and it talks about going on low first, doing one cycle or one set for a week. It said something about increasing after a week. So when it says increasing after a week, do you mean do all of those sets in there? I think there were 6 sets, and then do like it twice a day the second week, or am I supposed to do only one set the first week and then increase to 2 sets the second week? That's where I was a little confused.
When we write a manual, we have to write for the, I'll say, the least capable individuals. So if when we say one cycle set once a day for a week, this is for a person who is not an Olympic athlete, not a fit adult. And so we always default to a very, very low, not low level, a very, very casual level of KAATSU. The most important thing to know on KAATSU is you want the bands to engorge your limb in blood. That is the most important thing. With nothing else, if you don't engorge the limb in blood, then you're not doing KAATSU. And the way you check that is you put the band on, and in your case, you'll only have one working band. So fortunately, you'll have to use one arm at one time, and then the second arm, you have to remove the band from the left arm, put the right, or vice versa. But in this case, what you want to do is you want to put the band on. You want to compare your right hand with your left hand. You want to see that you have more pinkness or rosiness on the band with the KAATSU on. And then you want to start at low pressure for the cycle. If that is comfortable for you and your hand is getting slightly more pink, and it's a visual cue, slightly more pink, you're good to go. If you would like to do more than one set, because you feel comfortable and it feels good and you have time, then by all means do so. Now, that being said, the best thing for you to do is write to info@kaatsu.com. Tell us precisely what you would like to achieve, and we will answer you in a recommended program for you. Because we don't know people's ages, we don't know their station in life, we don't know if they're disabled or not, or have any kind of health issues. So if you tell us more about you, then we can customize a program for you to achieve your goals. Now, what your goals might be for this year might be different from next year. Maybe you want to run a 10K, or I don't know. Some people want to be able to touch their toes or whatever the case is. In those cases, we will provide you with very, very specific durations, very specific protocols, and very, very specific time. So if you have info@kaatsu.com, give us a little bit of background, and we'll give you a very specific program to work on.
Oh, okay.
Jessica,
So for yes.
From what Steve said, and Steve and Chris, please correct me if I'm wrong. I found that you got to tailor make to every individual. You have your basic protocol Steve has, and I struggled with this at first too. And I found out that some people adapt extremely well, other people don't. And I mean, I couldn't tell. I thought big strapping person, they can handle a lot. Boy, I was wrong. Or I had what appeared to be a weak, thin person. They handled KAATSU. They were right in a week at, as if they've been doing it all their life. So you sort of got to trial and error and follow the protocol Steve was talking about, the the rosiness of the palms and the capillaries, any discomfort. And you'd be surprised, it builds your confidence, and your endurance, your stamina improves as well. Some people are faster, some people are slower. And when you run into problems, that's a really good time to ask, to reach out.
So to start, I should try like I can use the one band, but arms first and then the legs. And if I feel comfortable, it's what's the most someone does? Because I would definitely only do it on low for a while because I'm not in a rush, And from listening to what you're saying, low seems to be a good thing to be on in the beginning, anyway. But like I think on average, would you say, because I'm a pretty average person, I'm like middle age, like 50, I'm fairly healthy, I do farming, but I'm not like a runner that goes out and lifts weights and runs all the time. I get exercise through work. So is like maybe one in the morning, one at night, like an average thing people do, kind of.
That sounds plenty. Just from my personal observation, I don't think you found a barrier, a boundary yet. So I tend to say when it starts to hurt you or find discomfort, or your hand isn't turning from blanche to pink quick enough, you've gone too far.
Okay.
I use those.
Okay.
That's how
I just got to try it.
that's
Yeah.
But again, Steve and Chris have a lot more experience with this on a variety of people than I do.
Yeah, and Jessica, I might just add, and it sounds really, really silly to say, but with KAATSU, less is more, but a lot of less is better than less. So less is more, meaning pressure and repetitions. Dr. Sato spent 4 decades creating a modality that is supposed to be comfortable, and that's why people of all ages, including my parents, as I mentioned before, and at the same regard, we have seen some. It's the professional athletes who think something should be uncomfortable to help you, and finally, after a lot of convincing, I tell them, well, when something's uncomfortable, it's your body saying stop, right? If you run a marathon until you can't go anymore, well, you're stopping because you can't go anymore. So it's not something that you're supposed to be uncomfortable. So with the other gentleman as well, what we're explaining is you always want it to be comfortable. You want to push yourself, not push yourself to be uncomfortable, but push yourself to move forward.
Okay, well, thank you.
So Steve, we had some more hand raises. I think in our order. Yeah, there we go. Thank you, Ralph.
Hello.
Hi, Susan.
How are you?
Good.
So I'm a 71-year-old active person, and I took a bad fall a week ago today. Hit my head, got stitches, and I got a closed avulsion fracture of my ankle. I just started doing my armbands again yesterday. My question is, should I just do the leg band on my good leg? I still have a lot of swelling and bruising up the calf and the foot of the one with the fractured ankle. And what exercises would I do if I did do the...
Susan, this is right in my wheelhouse. First of all, that type of avulsion fracture, it's down at the ankle, the KAATSU leg on that side, unless you have some issue, should not be a problem. It's nowhere near the trauma side. But outside the KAATSU, just already, the repair process, because it's at the bottom of your body when you stand up, you got a column of fluid, blood and lymph fluid and water coming down, and it can't get back up.
Mm-hmm.
Before I go back to the swelling is one of your biggest issues. So in addition to the effects of KAATSU, physically, what I'm doing during the day, my patients, I have what I call rain gutter elevation. And because a lot of people say elevate, but they really don't go into the details, and that's a nuance.
Uh-huh.
doing something, after, like, if you're not doing something you have to do, sit down, get your ankle about an inch above your knee, like a rain gutter. And
Okay.
you can sit for hours. You watch, Dr. Zhivago or play, several rounds of dominoes, and your foot doesn't fall asleep. And gravity by itself, fluid dynamics, the fluid, the swelling for your ankle has to come back to your body. And you get rid of that swelling. I don't care so much about the bruising. Bruising doesn't hurt. It's the swelling that causes the pain and discomfort and impedes healing. So
Uh-huh.
I'm doing that constantly. Now you add in KAATSU as well. Say you're going to go for a walk or do something, you're adding to it. But it's in between KAATSU cycles, when you're sitting around, like I'm sitting in this chair, if I had your injury, that'd be one of the worst things for it. My feet are down and my whole body column of fluids come right down on it. And that injury has to heal. And you've got bone, muscle, soft tissue, and connective tissue, which heal very slowly. So I'm just a huge fan of proper elevation. And again, I call it rain gutter elevation. As an aside, people tell you, oh, put toes to your nose or up to your head. The next person who says that, ask them to try it themselves and time them. You can't go 15 minutes. Your leg falls asleep. So
Yeah. Well, that's what
Yep.
the ER doctor said. Have your foot above your heart. So I've got my foot on 4 pillows and laying on my back, and
been there, done that. I spent a decade and a half telling people that, until finally one day, one of my patients post-op, she had almost no swelling. I asked her, what did you do? And of course she said, I did what you told me to do. So I said, well, what was that? And she described to me, and I followed up on it. If you have your ankle just barely above your knee, the fluid from your toes to your ankle to your knee to your hips, it all goes downhill. Anything higher, the blood can't go up. And that's where your foot begins to fall asleep or cause.
yeah. Okay. And okay, so I'll do that then. And you said that it is safe to use the KAATSU band on the injured leg?
In my experience using KAATSU, my patients who did use KAATSU, and again, I work for a big corporation, so to use KAATSU was squeezing the KAATSU education in my 15-minute window to treat a patient. The ones that did, I'd never had a problem. That's anecdotal, but from a physician point of view, because that's not the area of injury, if you use KAATSU correctly, I see no contraindication to using KAATSU for your injury.
Okay. Okay. And I know you talk about doing exercises while you're doing the bands, but I'm not supposed to put any weight on my foot. So
You just want to heal. Simple range of motion, what's called passive. So if this is your ankle, here's your knee, your ankle is an inch higher. You can, up to tolerance, wiggle your toes, do slow range of motion, up and down. And
okay.
you can do better and better. And if you want to, then you can take your hand and start moving your ankle side to side all around. And you get a little bit better, a little bit better. But focus on that edema. Get rid of that edema. If you get that primary to go away, it just sort of falls together like a cogwheel. Just things get better and better, and the KAATSU just exponentially speeds that process up.
Okay, very good. All right, thank you very much.
Sure.
Stephen, we're going to go with Heidi next. She's had her hand up for quite some time. I think, was it? Yes.
Hi, can you hear me?
Yep.
Okay. Yes, thank you so much for your expertise, all of you. Really appreciate it. I want to ask you if KAATSU will cause varicose veins or spider veins to get worse if you're using that pressure on your leg.
They actually, so you have to ask yourself, why does varicose veins and spider veins occur? The varicose veins occur largely because as the blood is going down your leg and then back up to your leg, there's valves in the veins of your legs, and those become less elastic. And what happens is there's a backflow of blood in those veins, and that's what we see is varicose veins. Now, over time, and what I mean by over time, literally between 6 and 18 months, if you do KAATSU regularly, especially on your legs, those valves become more elastic. As they become more elastic, they start functioning as they were functioning when we were much younger. So as the valves become much more elastic, the backflow of blood actually should.
So your answer was
Broke up there a little bit.
My answer is no, KAATSU should not cause varicose veins. Spider veins, it could be, I assume that it could be maybe you're doing a lot of work. I don't know, maybe squats or something.
Well, Steve, if I jump in, the spider vein, I used to treat those a long time ago. They don't have valves; they're too small, and you have millions and millions of these small veins, spider veins, and it's the same concept. The backup of pressure, it blows them out, and then instead of being a nice tiny little vessel, it becomes a big vessel, and the blood pools there. I've not treated long-term KAATSU, but reading the literature, as well as the fact that we know that KAATSU generates what's called a vessel growth hormone. And years ago, I saw an article, a book Dr. KAATSU presented with a gentleman's artery that wasn't present. After 6 months of KAATSU, you began to see an artery. And that just was incredible to me. And because it stimulates a hormone that repairs vessels, and veins are a vessel as well as arteries. And I believe the long-term effects that verifies what Steve's talking about. Over time, these vessels get healthier.
okay.
And it's more,
That sounds good.
more cosmetic. I hate that term, but unfortunately, spider veins. I used to just do concentrated saline injections. But I would think this KAATSU would be a great way to go because you're not going to hurt anything. I think you're only going to improve the vascular health.
Okay. Well, I don't have any varicose veins yet, but I do have these spider veins, and I just wanted to see if that would get into.
I'd almost just take a photo now, date stamp it, start doing KAATSU, and every 6 months take a photo of the same position, same area, and same lighting. See if you notice any improvement.
Oh, good idea. Okay. All right. I'll do that. Thank you so much.
Thank you, Heidi.
Okay, Stephen, I think we've got one more hand up, and then we can go back to the questions. We have Doris who has her hand up.
Hello, can you hear me?
Yes.
Yes, hello.
I have lymphedema, and I have had it for years in my lower limbs. I have not had surgery of any kind. It started as primary lymphedema, and it is going into secondary. Now, I have been hearing about KAATSU for about 3 years now, and I wanted to try it, but I want to know how I use it with lymphedema and edema.
Steve or Chris, that's a much more chronic condition. And some people naturally have smaller lymph channels, and I don't know the effects. I think it'd be favorable, but I'm just talking from I'm projecting. I think Steve or Chris may have more experience with that.
Okay, I'm sorry, I didn't hear much except lymphedema.
She has chronic and secondary chronic lymphedema. Steve.
So what I would recommend is start on your arms only. Only do arms. Do what Dr. Nalli recommended. Take photos or whatever, privacy of your own home. Do a month of KAATSU on your arms only. See if there's any effect whatsoever. And when you're comfortable with the KAATSU on your arms, then perhaps a month later, it could be 2 weeks, it could be the next day if you feel comfortable, put the bands on your legs and only do KAATSU Cycle when you're sitting down. And if you're going to do any exercise, it'd be something like what we call the KAATSU 3-point exercise. And that is precisely yourself. You curl your toes as you're sitting, barefoot on with your feet on the floor. Curl your toes, then raise your toes, then do some ankle rotations, and see how that goes for again 1, 2, 3, or 4 weeks, and then you can contact us again and we can guide you through the next stage. So in summary, start with your arms, do it for a certain period of time, then as you're sitting, do KAATSU Cycle on your legs with very, very minimal movement that, curl toe curls, toe raises, sitting heel raises, etc.
And
The measurements of your arms is different from the measurements of your legs.
correct.
So would that wrap around my legs?
No. So
You're frozen.
Doris, you got to measure your thighs, and you got to measure.
Yes.
They're going to be different. The bands are different between the arms and legs. They're not the same type of band, and you need to measure to get the correct size of band. And then what Steve was saying, and paralleling what Chris was saying, a little bit often, a low pressure a lot is going to help. And it's not going to be an overnight success. I think there's high chance you always have some form of edema, but can we reduce the symptoms, reduce the amount of edema? That'd be a very favorable outcome, but it's not going to happen overnight. And you got to be judicious, you got to be routine on this.
Thank you very much.
All right, so now we have Steve. We have some. We got all the hands answered, and now we're on to back to the Q&A. Oh, Steve is
Chris.
Okay. So we have a question from Mona again, who raised her hand earlier on. So she asked what the protocol that is used for strengthening the core. She mentioned, I remember the mention of water polo players using it for their core.
Okay. So on dry land, we'll explain what water polo players can do later. But on dry land, you can do 3 exercises, 3 very simple exercises. You can sit down and sit up very straight, like this, shoulders back, straight spine, and do whatever you're doing. Work on computer, read a book, watch TV. But sitting up straight, at a 90-degree angle, feet flat on the floor, with your stomach in, is one. The second is, we mentioned it earlier, balancing on one foot. Some people are extraordinarily good on balancing with one foot. Other people are not so good. Bands on the leg. All of these exercises are bands on your legs. Band on the leg, raise one foot off the ground and hold it for as long as you can. When your leg tires, switch to the other leg and go back and forth there. Always with the leg bands, always on the KAATSU Cycle Mode. 3, if you're really good at balancing on one foot, then take 2 water bottles and start moving them around randomly as you're balancing on one foot. That will put additional stress on your core. And 4, put a book on your head and walk back and forth. It could be outside, it could be inside your home. Just walk. When the book falls off your head, put the book back on your head and then walk like a supermodel with your shoulders back, a straight spine. Those are really simple things you can do in your kitchen, in your living room, etc. If you want to do planks, you can do planks. If you want to do sit-ups, you can do sit-ups. If you want to do leg raises where you're lying flat on your back and doing leg kicks or leg raises. If you're if you're in the water, you can hold your body against the wall, and so hold your body against the wall and lift. Sorry, how do you do this? And you, yes, there you go, like that. You can lift your legs, and that's really, really difficult because the force of the water is doing this. If we're talking about water polo players, simply putting bands on your legs and then doing egg beater or treading water is extraordinarily good. You can also go in a shallow end of the pool and simply walk forwards, walk backwards. You can take a giant ball, a balance ball, one of those big giant bounce balls, and climb on top of that ball and balance while you're in the water. So there are lots of things you can do on land and in the water to help improve the core.
Steve, can I interject? For some of our senior patients also, if they're a little older, I go back to the basics. When you're first going to try standing on one leg, a lot of my patients, even as young as 60, would fall over. So I first have you stand next to a table or a wall, rest your hand on the table, not holding on to it, just as a point of reference. Lift one leg, just 1 foot, like a couple inches off the ground, and count. You get to 30 and do the other. It sounds simplistic, but a lot of people will be surprised they have to hold on. Once you pass that test, then do it again without holding on, but your hands are balancing. And then the next test, before you go further, put your hands on your shoulders and try to go up to 30 seconds on each side. And this is for people who are not sure, some of our older clientele. It's a little safe way to start with, and then work your way up the ladder like you spoke, Steve, because some folks just couldn't even stand it. They wouldn't even try it. I had to really boil it down to very simplistic ways, such as just starting, hold on to the side of the table.
Thank you, Dr. Lyle.
Chris, where are we on the question?
Okay, so the next question is from Trudy asking, does KAATSU help with nerve regeneration?
Nerve generation? No, it won't. It won't.
Nerve regeneration.
No, it won't. It won't. Now, it can activate current nerves, and we see this often with amputees or people who are disabled. We see a reactivation, but the regeneration, did she say? I'm sorry, I can't.
Regeneration. That was the question.
Regeneration. Does that mean a growth or that means activation? Not sure.
No, that means new nerve growth.
Yeah, that won't occur with KAATSU.
I think, Stephen, if you just on that topic, if you want me to share, I just have a quick little image of Justin, if that would help. I'll just quickly share my screen. Here we go. Hopefully you can. Stephen, can you see my screen? Yes, no. Lyle, can you see my screen?
Yep.
Oh, great. So if I just, this was just a little presentation I had for today, but if we just go here, just go down to some of the slides here, pass by. Again, some of you on other webinars have seen some of these slides, but just want to show, well, this is a lot of what we're talking, right? This is a lot of us here today, KAATSU in actual practice. But if we talk about nerves, excuse me for fast forwarding. We're looking at amputees. Well, this is going to be really interesting to our discussion. So here, so this is Justin, who there's no audio, but if you can just watch the video, you can see that he has an amputated arm. And what was very encouraging for Justin is You can see the good coloration, and you can actually see the shaking of his limb. And for him, it was really an incredible experience to have less pain in his amputated limb, and also to have some strength gains. So just showing that. But going back a couple slides, excuse me, as I'm gonna stop this slideshow, stop share. Okay, so we're back. So just wanted to show that quickly, Stephen, with the nerve. So there's no regeneration, but there certainly is activation, especially we've seen in amputees who have neuropathic pain. Has been a really, really important and eye-opening thing for us, not only as scientists, as doctors, as physiologists, but also just as lay people who are seeing a lot of decreased pain.
And that's another form of area of research. I mean, you can't regenerate the nerve, but why are the symptoms getting less? And that may be some ancillary or secondary process that maybe the nerve doesn't fully heal, but the part of the nerve, I mean, the nerve is like an old telephone cable. One is pain, one is for muscle stability, one is for swelling, one controls this. So you have the whole cable of nerves, you have damage to it. We're trying to reduce the one that causes pain and discomfort. And KAATSU, through its cascade, or Chris call it fertilizer of ingredients, I love that term, is making that part of the nerve, the symptom, the pain receptors, less sensitive. And that can allow a better quality of life.
Thank you. So, Stephen, next question, just from an anonymous attendee is, are there any issues with aortic aneurysm, the medium size 4.1 centimeter aortic aneurysm?
Yes, there are issues. It's not going to cause the aortic aneurysm to get any worse, but we always want your cardiologist to approve the use of KAATSU or anything. You always have, this is, you might want to run a marathon, but you want to check with your doctor if you have a 4.1, aortic aneurysm, just to be on the safe side. And unfortunately, we do have people with aortic aneurysms, including our CO himself. And, he does it, but he also has confirmed with his cardiologist that he can do it. And he brought the machine into the doctor's office and actually shown the doctor what he actually does. So, always, if there's any cardiac issues, always default to your healthcare professional who knows you.
So, Stephen, the next question is from Mark. It's actually a very appropriate question. Mark says, I was just diagnosed with high blood pressure. The doctor said this is typical as one gets older due to blood vessels getting less flexible. I'm 69 years old. Will KAATSU help by increasing vascular flexibility? So, Stephen, before you answer that, I just want to share with Mark. So my family, Mark, unfortunately, we don't have a lot of obesity, but we do have some genetic high blood pressure. And both my father and my younger brother, who is a nurse, have high blood pressure. I also had high blood pressure until I became a diehard KAATSU user. So again, Dr. Lyle, I hate to continually share anecdotal stories, but I not only take zero medication, but my blood pressure, I take it about twice a week now. It's perfect. I'm 55 years old, whereas several years ago it was dangerously high. So I'm very encouraged that, and I know I have changed my diet slightly. I still have some cheat meals more often than not, but so Stephen, now I'll let you answer, and we might even want to turn Mark onto our cardiovascular age project.
But that goes along with the literature talking about the vessel stimulating growth hormone. I was involved trying to get through to work on diabetic wound care, and we needed the circulation to the foot. It was weak. And that was one of the selling points. It demonstrated it does generate this or increase the production of it. So it makes sense, Chris, for what you're saying, that your symptoms would improve.
So to answer the question, yes, it can improve, but you must follow the protocols. Again, there was an earlier user who liked to use high pressure, but it caused numbness and tingling. We absolutely want you to avoid that. So the basics are be very well hydrated when you do KAATSU. Only use the KAATSU cycle. Always start in the low pressure mode. Do it while you're sitting down and do it frequently. If you follow those basics, and of course you're checking your capillary fill time, so your hand is pink, but if you push your thumb or your forefinger into the palm of your hand, it comes back to a normal color within a second. If you do all that, you will achieve an increased elasticity of your vascular tissue. And if you do that, imagine the pikes that are going throughout your body become more elastic. The chances of your blood pressure being reduced are more than likely. It's not a guarantee. It's not a cure. It just will working on the vascular tissue.
Well said, Steve. My experience is that in our society, well, if a little bit is good, more should be better. I've been guilty of it. A lot of my patients have. But everything we just talked about right now, what you just said is probably the key ingredient. Follow the protocol. A little bit is good. Often is better than trying to make it harder on yourself.
And Stephen, if I could, just for Mark, I believe that was the gentleman who asked the question. If any of you are following in the chat with Ralph, we have a really exciting and interesting project. Stephen, thumbs up if I can talk about it just for 2 seconds. Steve, thumbs up. Yeah. Okay. We're working with another company with a device called the Aura Ring, and if any of you are familiar with it, very neat, very advanced product. So there's Aura Ring. There's a couple other products for monitoring a lot of our biometrics, and we partnered with them on a project for cardiovascular age. So if anyone's interested, we highly encourage you. If you don't have KAATSU yet and you're thinking of a way you'd like to be more involved, and especially with your own health span, lifespan, as we're all right now, those are the buzzwords. So I encourage you to follow that chat, and Ralph has put it up. But on our website, which is just simply kaatsu.com, you can find more information about that. That's all the hands and all the questions, Stephen and Lyle.
Great.
Well, thank you very much. If anybody had any additional questions or you thought of something that you should have asked, you didn't, email us at info@kaatsu.com, and it's 90% chance we'll answer within a day. If not, give us 2 days and we'll answer a very specific question that applies to you. And we're very and thank you very much for joining. I'm sorry about this background noise, but thank you again.
Thank you, Steve.
Yeah, thank you, Stephen. Thank you, Ralph, for helping us out.
Yeah.
Thank you, Dr. Lyle.
Dr. Morgan.
Yeah, right. See you at the pool, Dr. Lyle.
Okay. Bye, everybody.